Now, sex after menopause shouldn't hurt, yet so many women silently endure it. If you've been avoiding intimacy because of pain, dryness, or fear, you're not alone. Now, if every intimate moment feels like burning, dryness, or tearing, please know it's not your fault and it's not something you just have to accept. A patient once told me, I thought intimacy was over forever with menopause, but it wasn't. With the right treatment, she regained not just her comfort, but confidence and connection again. So let's talk about why this happens and how you can get relief. Hi, I'm Dr. Sadaf, a board-certified OBGYN, Menopause Society certified practitioner, and Ishwish Fellow. Let's talk about why this happens. Now, women, when they go through menopause, their estrogen levels drop. And that drop doesn't just affect mood or cause hot flashes, it also changes the vaginal and vulvar tissue. The genital urinary syndrome of menopause is a medical term for the common symptoms that women can experience in the genital and urinary areas after menopause. It happens because the body produces much less estrogen and testosterone once menopause begins. Without enough estrogen, the tissues of the vagina and lower urinary tract become thinner, drier, and less elastic. This can lead to a variety of symptoms that can affect comfort, sexual health, and urination. Blood flow also decreases, natural lubrication reduces, and the pH balance changes, all of which can make sex painful and even lead to small tears or burning after sex. Now, here's something a lot of women don't realize. The urethra and the bladder are also affected. That's why many women start noticing urinary urgency or more frequent urinary tract infections around this time. GSM can include vaginal vulvar symptoms, dryness in the vagina and vulva, irritation or burning, and pain or discomfort during sex. Some women also notice itching or that the vaginal opening feels smaller or less flexible. Urinary symptoms. So now the urinary symptoms, problems like burning or pain when urinating, feeling an urgent need to urinate, going to the bathroom more often, or getting your recurrent urinary tract infections. This occurs because the urinary tract tissue is also affected by low estrogen. Some physical changes that doctors might notice are paler, thinner vaginal walls, smaller labia due to tissue shrinkage, a narrowed vaginal opening, or changes in the vaginal pH because the microbiome changes. These changes are supportive clues that a woman has genital urinary syndrome of menopause. Now, if you're experiencing pain with sex and bladder symptoms, it's not just in your head, it's connected and it's biological. It's important to know that GSM is very common after menopause. Many women experience some degree of these symptoms. The good news is that GSM is treatable and addressing it can improve quality of life. For example, making sex comfortable again and reducing urinary tract issues. The American Urological Association guidelines that were developed and released this year created a healthcare algorithm to help treat women with GSM so they don't have to suffer in silence. Now, why it's often ignored? It's often ignored because women don't know that they don't need to suffer in menopause and also that there's help. Also, it's so important for you to know that if a doctor tells you to use Crisco, the problem is not going to be resolved with Crisco. Now, let's talk about solutions because there are so many and they actually work. Let's break down the treatment options mentioned in the guideline, in the American Urologic Association guideline. So first, they mention local vaginal estrogen. This is the first line treatment. This is low dose vaginal estrogen that can be applied directly to the vagina, and the guidelines strongly recommend that it is the initial treatment for most women with GSM. By delivering a small amount of estrogen right to the vaginal tissue, it can reverse dryness, improve irritation, and reduce pain during sex. It can also help reduce urinary issues. For example, by improving urethral health, it can in fact help women have less UTIs after menopause. And it can help with the vaginal microbiome. The vaginal estrogen comes in several forms: creams, tablets, suppositories, or small estrogen ring, and sits in the vagina. All of these deliver estrogen locally. According to the evidence reviewed, even some studies that were small consistently showed that vaginal estrogen makes symptoms better and does so with very few side effects. So the guideline also highlights that vaginal estrogen is super safe and does not significantly raise estrogen levels in the bloodstream. So it does not increase the risk of breast cancer, endometrial cancer, heart disease, or dementia. Concerns that people have used to prevent others from using vaginal estrogen. There are other hormonal treatments available. If vaginal estrogen is not an option for you, if you want other alternatives, the guideline notes that there are a couple other hormone-related therapies. There's something called vaginal DHEA. So DHEA is another hormone. It's a precursor that can convert to estrogen and testosterone in the body. There is a vaginal insert suppository form of DHEA that's approved for the gender urinary syndrome menopause. The guideline considers vaginal DHEA a reasonable option that can improve vaginal dryness and pain during sex. This is seen as moderate strength recommendation, meaning that the experts find it useful for many patients. And like estrogen, it is applied locally, so the suppository is inserted into the vagina and works on the vaginal tissue. For women who cannot use estrogen at all, DHEA might be an option for them. The evidence suggests it helps with symptoms and also appears safe in terms of not causing any type of estrogen-related side effects. Now, there's another option, something called acetaminophen, which is an oral pill, and it acts like estrogen in the vagina, but without being a hormone. It's something what we call a selective estrogen receptor modulator, and it is another option to treat painful intercourse and dryness. The guideline gives us acetaminophen a conditional recommendation, mainly because there is somewhat limited evidence and it's not commonly used as a vaginal therapy. This means it's not typically the first choice, but obviously it can be used for somebody that prefers not to take vaginal estrogen and doesn't want to take DHEA. Now, there are other options as well. So some women don't want any type of hormonal therapy, so they can use a vaginal moisturizer. I would tell you though, the vaginal moisturizers are not going to fix the vulvar and vaginal tissue, and they're kind of like a band-aid. Like you know, a lot of women will use them in between their vaginal estrogen. So, they'll use vaginal estrogen twice a week, and in between they'll use the vaginal moisturizer, and it reduces dryness and irritation in the vaginal tissue. The guideline recommends moisturizers as a helpful option, especially for milder symptoms or for women that just don't want to use hormones. It can be used alone or in addition to other treatments. Lubricants can also be used, but lubricants are used for sexual activity. I don't want people to think that lubricants are going to take care of their GSM. Lubricants are used at the time of sexual intercourse or other sexual activity to reduce friction and pain. So the guideline encourages using lubricants liberally to make sex more comfortable if you have any dryness or pain. This is an easy, immediate fix for discomfort during intercourse and can be used by anyone, whether or not you have GSM or not. Now, pelvic floor physical therapy and sexual health counseling. Depending on your symptoms, doctors may refer you to specialists like pelvic floor physical therapists or sex therapists. And for example, if GSM has led to painful sex and secondary pelvic floor muscle tightness or anxiety, a pelvic floor therapist can help with exercises and techniques to relieve discomfort. Now, of course, if you've been suffering with GSM for a long time, it's going to affect your relationship. So pain with sex and menopause is totally common, but it doesn't have to be normal. And oftentimes this can result in loss of libido, pain with sex, and a negative impact on relationships. There can even be secondary issues for the partner, such as erectile dysfunction and premature ejaculation. If the symptoms are affecting your intimate relationship or emotional well-being, make sure you go and see a sex therapist. That can be super helpful. And if you're struggling with painful sex after menopause, you deserve answers and relief. On my YouTube channel, I share more in-depth videos like this to help you understand your body, your hormones, and your options for care. So don't forget to subscribe so you don't miss what's next.